Good afternoon, everyone, and welcome to our October Facebook Live Lunch and Learn. This month is October National Physical Therapy Month, so we have a special guest. We have Mike Jones, and he is with our ACMC Physical Therapy Department. So welcome.
Thank you.
Would you like to talk a little bit about yourself and background and kind of what you do for ACMC?
So this is I'm going into my 10th year next year working for ACMC, which is pretty cool. I went to Chatham University for my doctorate of physical therapy. We have a clinical doctorate with our degree. So not a real doctor, but at least I have that going for me. I have a pretty good manual therapy background. So I've started, it's called a Maitland program. So it's basically mobilizations. It's almost like, kind of like chiropractor-esque. It's not the same though. But so yeah, I go for that certification in June of next year. I've been treating everything from 2-month-old babies to however old you want to get. But we basically see it all over here.
So when you say manual therapy, like for example, what is manual therapy?
So manual therapy is basically anything where you might be taking a patient through range of motion, applying a treatment modality such as like a massage, or in this case, what we're going to be showing today is needles.
Okay.
But basically, you're using your hands, your body positioning to help a patient either increase range of motion, decrease pain, all with the goal of improving function.
Okay, so it's more manually, meaning hands-on. You're not really using a piece of heavy equipment or something.
No, although I suppose you could. There are certain ones that might use like something that looks kind of like a torque hammer to do their manual therapy.
Oh, that sounds painful.
Yeah, we don't do that. We don't do that. Torque hammers are expensive.
So what kinds of specialized manual therapies? I know we mentioned in our poster that we put on that you do dry needling and mobilization, and like what are some actual techniques that you do?
Yeah, so we do mobilizations, which would be anything from, it's basically a motion that you can't do by yourself, that you would need somebody else to take you through that motion. So the biggest thing that comes up is the spine. If you put your finger back there and you get those little spiny projections, a very popular one that we would do would be called a posterior to anterior mobilization. So we would push on that area of the spine. And that's not something that you can necessarily do physiologically. You can't tell yourself, I'm going to move this vertebra forward.
Right.
So it helps to have somebody else do that. And it helps with other motions. And it's really popular for arthritic patients or patients who have went through like some kind of injury.
So you really see a broad spectrum of patients. You said all the way from babies all the way to elderly. So what types of therapies do you do for children?
For children, it's mostly a lot of stretching. I see a lot of our kids that have torticollis. They might have a stiff neck.
Okay.
So we might do a little bit of very light myofascial release, like a massage. But most of it's just stretching. And most of the time it's plain, just to make sure that they are tolerable of the therapy.
Right.
We don't do a ton of manual therapy intervention with our little ones besides that massage.
Okay.
But it has an element.
And then what about like student athletes? Do they come in with injuries, or like what types of therapies do you do for an athlete?
Yeah, so mobilization is a big one for them too. We have something called an instrument-assisted soft tissue mobilization, which basically just looks like a glorified butter knife. And we use that to massage. It helps with blood flow circulation. It helps with tissue reconfiguration. So it's something that we would use especially after post-surgery, once it's healed up enough. If they've had like an incision, it might help with the scar tissue to lay down a little finer. We can also do dry needling on those populations as well. It can be used from anything such as like a strained muscle to a scar tissue that needs to be reformed. So it's pretty broad.
So is that the same as acupuncture, or is it?
They're different, and it is state different. I'm required by law to say that they're very different.
Okay.
Whereas acupuncture uses traditional Chinese medicine, meridians, energy lines.
Okay.
Dry needling uses the application of the needle to transduce a mechanical force to an area that we want to make a change.
All right. And you mentioned to me before the filming is that you actually have an injury.
I do.
Yeah, so we were going to actually demonstrate what dry needling is. So would you like to introduce your colleague here? Yeah. And we can do a demonstration of so you can see how beneficial this is and painless, right?
Right. I promise not to
okay.
scream.
All right.
This is Cody Blood, Dr. Cody Blood. He's a physical therapist that also does dry needling. And we've been practicing dry needling at the clinic since 2019 is when we got certified. We relied heavily upon it during the pandemic because it was something that we could do relatively with less contact to patients. So, but yeah, I twisted my ankle. I've been trying to convince myself for the last month that I'm a runner, and it caught up with me. So I'm still trying, but I have a little bit of an injury. So he's going to dry needle my peroneals, which is the outside muscle group of the
All right,
calf.
do you want to grab that chair so then you can sit on the chair, and then we'll have you put your leg on the other chair so you can demonstrate how dry needling actually works.
Okay, so we always sterilize. We reduce risk of any infection.
And do you have a lot of patients that are doing this now?
We do. We're getting a lot more referrals specifically for dry needling.
Okay.
It's something that's catching on.
Okay.
I do it probably 3 times a week.
Wow.
Or so. I don't know how many times you're doing it.
Probably about the same.
Okay.
It has definitely picked up.
Cody's caseload for dry needling has definitely picked up more. That's
So
why
you're getting it because you hurt your ankle.
Yeah.
What are some other reasons people would get it? Other kind of injuries, you would use it anywhere on the body, or?
You could technically use it anywhere on the body. Spine, paraspinal muscles around the spine are big ones. Upper trap is a pretty common one. People generally get tight up through here. Anywhere in the lower extremity. There are certain courses that go in more depth.
Okay.
There is something called intra-articular dry needling, which is where they actually go into the joint and they dry needle certain spots in the anatomy. I don't have any intention to do that. I don't know about you.
At this point, not quite yet. Not quite yet.
But technically, they can go anywhere.
All right.
Okay,
So what are you about to do here?
So we're ready to go. So these are, I don't know if we can zoom in on that. These are the needles here. So they're pretty thin. They're not like a thick needle like you might expect with a blood draw or an injection of some sort, but pretty thin. So it's usually pretty painless depending on how restricted the muscle is. If we're looking at a bad restriction, sometimes it can be a little achy when we first put it in.
And I noticed that you brought the thicker needles.
So this is a thicker needle. That's
Okay.
because Mike has some thicker hide in his calves. So in this instance, we'll do is some of this peroneal group, which kind of helps move the foot to the outside and stabilize that. But we wouldn't use the entire depth of the needle. We might use a 1/4 inch, 1/2 inch, depending on where the restriction's at, what we need to get to. So they're pretty tight right there. And of course, we have a good knowledge of anatomy.
He's still
You
smiling.
can zoom in on my face. It's okay. It's just one single tear going
Yes,
down.
the needles are they're very, very small.
So they're very small, and we go right into the muscle belly. And if we get where we need to go, it feels like a deep ache, a twitchy type feeling. The muscle will actually kind of grab right onto that needle and hold it into place until it's ready to kind of let go and loosen up and get it back to us.
So how long do you leave the needles in?
Depends on the restriction within the muscle itself. It could be anywhere from 5 minutes to 10 to 15, depending.
And then do you put more than one needle in at a time?
Oftentimes, yes. So we're looking for specific spots within the muscle belly that are restricted. Trigger point type areas, pressure areas that you would get. So it could be, and oftentimes is more than one particular spot along the muscle belly. So.
And it's not uncommon when you get a dysfunctional motor endpoint, not that you'll get like a little bit of a spasm. So the whole tissue will kind of do an involuntary spasm. And that's when you know you've got a really good one.
Okay.
So you might have the feels for a little bit, but otherwise it's pretty pain-free once you let it get in.
And then how many sessions do you typically do for a patient?
It depends on what we see. ideal patient, and this is going to kind of sound bad, is the one that you go in, you do it, and they say, I felt great, I don't ever want to do it again.
Okay.
Because it's an anxiety-provoking
Yeah.
thing. People don't like needles. But generally, it's many times we need help with restriction or pain.
How's it feeling?
Fine.
Feeling good?
Yeah, I had a little bit of a twinge there at first, and then when he twisted up, it actually, if we look at it on ultrasound, the fascia and the muscle actually spin around it like a fork, like spaghetti on a fork. So I could kind of feel that a little bit. I could feel that little bit of a grasp.
That's a twitchy type
Yeah.
ache feeling that you might feel in that.
And as he moves it and twists it around, it intensifies a little bit, but it's right where I want it because I've been feeling this kind of a dull ache all the way up around here because I really twisted my ankle in. But luckily, I didn't. I was able to finish my run. I work with guys like this that can help me.
So other than dry needling, what are some other manual therapies that you're doing? I know we talked a little bit about other ones, but maybe some other examples of.
Oh, sure.
You're gonna take it out.
Other ones would include the instrument that we talked about, mobilization, just passive range sometimes too. Just having somebody else, having human touch is really helpful, especially after an injury. We get into that kind of the three phases of what we're working on, which is mechanical stimulus. We're thinking about tissue changes. We're also thinking about biopsychosocial response.
So what does that biopsychosocial mean?
So it's basically thinking about how after an injury, it's a really multifactorial thing that can happen. Somebody's not moving as much, so they're feeling a little bit down because of it.
Okay.
Or if they have certain constraints that limit their ability to get to therapy or something. Manual therapy is a nice way to kind of bridge the gap for those. Because not only can you get somebody feeling and show them that they can move their leg without further harm, you can kind of guide them with that, or extremity, doesn't have to be leg. And that is helpful in just kickstarting somebody's therapy experience. They can kind of run with the ball, as to say, a little bit easier after that.
So for those of you who don't know, physical therapy is now right next door to Premier Fitness. We actually share a door. So we've been, seeing therapists more often and vice versa. So what are some things that are coming? Are there any new technologies or new services that are going to be coming in the next few months?
In the next few months, we have kind of bolstered up our pediatric program a little bit more. So we have a big pediatric swing area. We have a new foam treatment room. So it has like all these foam stairs, foam ramps, things that the kids can kind of move around a little bit easier and not be afraid that they're going to bump into their head or something like that. The pediatric swing has been a big one because that is something that a lot of kids, especially those that might have some sensory issues, do really well with. So that's been a big improvement in the pediatric front. In terms of our more adult casework, getting into the dry needling more has definitely been helpful. We do a lot of things that are more with the joint, kind of similar to what a chiropractor does, but not necessarily the same, which is helpful too. So, and more of us are getting more comfortable with doing some of that spine care.
Well, we have a lot of older members over here at Premier. We have probably over 800 Silver Sneaker members. We do have a lot of people that are working out. And do you see like older folks having injuries for maybe they worked out too hard or maybe they've fallen? What types of services do you do for that population?
Absolutely. Just being older doesn't mean that you can't have a little bit of delayed onset muscle soreness after working out. It's relatively the same thing that you would do at any age. So those fit very nicely into the spectrum of things that we do. Dry needling is definitely one that we could offer that population as well. But if somebody who's just a weekend warrior and had like one of these nice weekends that we've had here in the fall, overraked, we see that a lot. People get a little bit of a rib restriction or something. Quite easy to treat with manual therapy. And generally it's either a 1 or 2 and done kind of thing.
Okay.
They don't need to come in and be here for like 10 weeks on time.
Right.
So.
Right. And then after they're done with their therapy, then do you recommend that they then continue on with regular exercise?
Absolutely.
And do you kind of help them with that transition?
Yeah, and there's a great place right next door.
Right, Premier Fitness.
So that's really been helpful.
Okay.
I know at the previous facility that we were at, we had a little bit of an aftercare program, but we had size constraints.
Yeah.
It is great having you guys next door,
Right.
so we can refer. And a lot of our therapies, generally at the end of our time together with our patients, we might bring them over and give them a little tour, have them operate on some equipment over here, just so they feel a little bit more comfortable. But it's been really helpful having that interplay. It's not just doing it in spurts, but it's that short, meaningful goals of exercising, movement every day.
Right.
That really make a difference.
And as far as like convenience of hours, like when do you typically open?
Typically, we're open from 8. Our last patient that we see would be about 5:30, and our sessions usually take about 45 minutes to an hour. So
Okay.
we're usually closing up shop around 6:30.
Okay. And do you have any weekend hours?
No weekend hours at this point. We do hospital coverage as needed, so a lot of our staff will be working over the hospital on the weekends.
Awesome. All right. Is there anything else you want to talk about? Any other services besides the manual services? That I know you have a lot. There's a lot of other types of physical therapy offered over there as well.
Yeah, I think what I would love to see in the future is just seeing people more for as needed little checkups. I mean, you see your dentist twice a year.
Right.
I think it makes sense just to go in and say, like, I'm getting older, or maybe I have this condition that I'm living with. Why not check in on it every once in a while? Ask your physician, hey, can I have an evaluation just to make sure that I'm doing okay if I'm moving as my age-matched peers should be moving. Just having that little bit of advice and knowing what kind of workouts might fit best for you
Right.
and your body type are
Maybe
helpful.
before you even start working out, just getting evaluated. Now, do you need a referral? How does that work?
So generally, because we're a hospital-based one, we like to have referrals from our physicians before we actually see patients. But one evaluation, it doesn't mean that you're going to be in with a huge amount of time commitment.
Right.
Maybe it's just a question of adapting a little bit of a home exercise program or doing something a little differently and then moving on. But I think the biggest thing is that I enjoy doing is surprising people with the goals that they think they can't meet on the first day and telling them, like, yeah, we can meet this right now. We can help you with that right away. So I think that's the nicest part about it, is that you can defy expectations, because I know PT, generally people think, oh, that's going to hurt. That's going to be pain. That's going to be work. But sometimes it's pretty easy, low-hanging fruit that we can take care of.
Great. All right. Well, thank you very much for coming and celebrating National Physical Therapy Month. Yeah. If anyone is interested in making an appointment for physical therapy, they can call 997-6680. And again, typically you need a physician referral, but definitely don't let that discourage you. Go ahead and I'm sure if they have a question, they can just pop over or give a call and ask, if any of the services that you offer would be right for them. Absolutely. It sounds like you have a lot of very high-tech and, new ideas.
Yeah, I mean, we try to keep up with it, so.
Yeah, so again, thank you very much for joining us. If anyone has any questions, just put them in the comment section and we will get them over to Mike. But thank you for joining us today.